Our next presentation, as I mentioned just before the break, is with Louise Healy. Louise is part of Rare Voices Australia, and we're a partner of Rare Voices Australia. And she's joined us today to present on some of the struggles that we go through mentally when it comes to living with a rare disease. And she's come to us today with a number of coping mechanisms and ways to deal with and to improve our mental health while living with a rare disease. So without further ado, I'd like to welcome Louise. Welcome, Louise.
Hello and welcome. My name is Louise Healy and I'm Education and Advocacy Manager at Rare Voices Australia, and I'm also a rare disease parent. And today I'm very pleased and proud to have been invited to speak at the ITP conference on resilience and mental wellbeing for people living with a rare condition. Before I start, I'd just like to let you know that the tools and tips provided in this presentation do not replace professional medical advice. And if you are struggling or someone you know is struggling, please seek support, professional support via your GP or your treating specialist. So before we start, I thought I'd tell you a little bit about Rare Voices Australia. Rare Voices Australia is the peak national body progressing policy and system change to benefit Australians living with a rare disease. And as part of that, they led the collaborative development of the National Strategic Action Plan for Rare Diseases. And so this action plan was launched by the Health Minister in 2020, and it represents the Australian government's policy response to the challenges that Australians living with a rare disease face. Rare Voices' focus and expertise is on policy and system change to address the unique challenges faced by the rare disease community. And as you'd be aware, there are many challenges, and I'm sure you have experience of them. In particular, the action plan focuses on awareness and education, care and support, and research and data. And RVA works in partnership with more than 90 rare disease partner organisations, including ITP Australia. We also work with researchers, clinicians, government and industry, and the focus is always about improving outcomes for Australians living with a rare disease. And when we talk about people living with a rare disease, that doesn't just mean the person who has been diagnosed with the condition, it also means their family, carers and loved ones, because as you would all well know, having a family member with a rare condition has an impact on the whole family, which I think we'll see in this presentation today. So just a bit of an overview about what I plan to talk about. I'll just give some brief research information on mental health and wellbeing for those living with a rare disease. And then we'll look at some simple and hopefully practical tips and tools to help manage stress and anxiety, strengthen your relationships, nurture self-management and focus on self-care. And hopefully as we look at the research, it will be clear why these are the areas that I've chosen to focus on. A little bit about the research. So living with a rare disease can negatively impact on all family members in the mental health space. And in particular, there is a higher incidence of mental health issues among the rare disease community when compared with the general population. Some Australian researchers asked families to rate the psychosocial impact of living with a rare disease, and they rated it, the majority of families, more than 90% rated it as having a high to moderate impact on their psychosocial wellbeing. Anxiety, stress, low mood and emotional exhaustion are often amplified in the rare disease population, including among family members and loved ones. And when researchers looked into what are some of the reasons for these heightened mental health issues, the kinds of things that rare disease patients talk about is feelings of isolation and loneliness, of carrying this journey alone. Many people have experienced misdiagnosis or had a lot of challenges in getting the right diagnosis. And as part of that journey, I guess a lot of people with rare disease describe not being taken seriously by health professionals, including one rare disease family spoke about going to the GP and the GP saying, okay, I don't know anything about your condition. I wonder what I should Google today. And that just exacerbated, I think, that feeling of being alone and being unsupported. Other factors are the lack of treatment options that are often available. So less than 5% of rare diseases have a definitive treatment option available to them. Poor care coordination, and many people will experience this, that you might need to see multiple specialists, but that's not coordinated, and that can be time consuming and frustrating. And so there's often a high burden of care of having a rare disease, and that burden of care will be felt by both the person who has the condition, but the people who are helping to support them, family members, loved ones, partners. There is, however, some good news around what can help to support improved mental health and wellbeing amongst those with rare, chronic and serious health conditions. So obviously the first line is always to seek support from mental health care professionals, and this is really well supported by evidence. And if, as I've said earlier, if you're struggling or you know someone who is, that's an option that should always be considered. But there is some good evidence for some lifestyle changes, community and personal activities that have been shown to improve mental health and wellbeing. So in particular, in chronic and rare conditions, self-management has been linked with improved wellbeing. It increases self-determination and participation in healthcare. And self-management really refers to that sense of being able to independently manage your condition, having some control and role in the day-to-day management of the condition. And what the research says is that earlier that starts, and this is probably particularly for people who are diagnosed early in life as children or adolescents, the earlier that starts, the better the outcome is in terms of that feeling of having an improved well-being, but a sense of control in the environment. The next thing that really helps is close and supportive relationships. And this seems to be a really protective factor in terms of mental health and well-being. So a strong family relationship with family cohesion or romantic relationship or friendships even, including peer relationships, can really, really have a positive impact on people's mental well-being. And I guess related to that is the feeling that the problem is shared with people close to you. So even though independence and self-management is important, it's also important for people with a rare condition and the families of them to feel that they're not alone and that they can reach out to people. Having a family who emphasises self-reliance, personal achievement and family cohesion also really contributes to better outcomes for people with serious chronic conditions. And so I think you can see there's a theme here about independence, but also that sense of self-mastery and being part of something close that supports you. And attentive responses to symptoms also came out in that research. And I think that relates to one of the earlier points where when people feel like their symptoms are not being taken seriously, whether that's by health professionals or people around them, that can have a really detrimental effect on mental health and wellbeing. And then in the Rare Disease UK report on mental health and wellbeing, many people with rare conditions and their family members reported things like physical activity, participation in research, and importantly, peer support. So reaching out to organisations like ITP has also been shown to have a positive impact. And then Beyond Blue has an excellent resource that looks at interventions that can support mental health and wellbeing and which ones have evidence for them. And there is evidence to show that things like relaxation training, mindfulness and yoga can have a positive impact on anxiety and depression and stress-related symptoms. So that's, I guess, what the evidence says. And what I'll move on to now is just to say to you that obviously being diagnosed with or having a loved one with a rare condition can impact negatively on mental health and wellbeing, and the research is clear on that. But it also shows that in addition to seeking professional support, individuals and families can improve mental health and coping through a range of strategies. So what I wanted to focus on now is what are some things that you can actually practically do to I guess to care for your mental well-being or improve coping or care for the mental well-being of a person, a loved one who has a rare condition. So I think the first tip is to manage your own stress and anxiety first. And this sort of comes quite clearly through the research. Stress and anxiety can be catching in a population. So I'm sure you've noticed this in your own family. When your stress levels are high, that can have a negative impact on the stress levels of the people around you. And I think it's also very hard to support someone if you're stressed and anxious yourself. So some things that you can do to proactively manage your own stress anxiety is proactive stress management strategies such as relaxation training. And this was mentioned in some of the evidence. Relaxation training, yoga or mindfulness are all things that you could look at as potential strategies. So a really good example of relaxation training that has a strong evidence base is called progressive muscle relaxation technique, and that the Australian website Headspace has a guided version of progressive muscle relaxation as a relaxation technique if you wanted to look at something like that. I find that finding the right relaxation technique is a very personal thing. And if you don't have one that works for you at the moment, I do encourage you to try a couple of different ones. So mindfulness is really about being more present and not getting too caught up. Anxiety is often associated with being caught up in circular thoughts that are worries and anxieties for the future. And obviously this is really a reasonable response to having a rare condition or having a family member diagnosed with a rare condition, but it's really recognising that lots and lots of circular worrying and anxiety doesn't actually help mental well-being. So with mindfulness, what you do is focus on the present moment and what you can do about that. The second thing is to build positive social support and connections. So that's with others around you. And in the next section, I'll talk about strategies for strengthening close relationships, but it's also about having a broad social circle and other networks, including a peer network so something like ITP can provide this, where you can talk to people. One of the most interesting pieces of research about what predicts resilience in people is that resilient people know when to ask for help. So contrary to popular belief, resilient people don't cope all the time. What they're very good at doing is knowing when they're not coping and reaching out to others to help. And I guess as part of that, the next thing that you could do is seek practical support. So we know that the burden of managing rare diseases can be very high. So whether that's for you as a person with a condition or somebody caring with someone with a rare condition, there are often lots of appointments, often the daily care is complex, there's therapies to attend. So looking for practical support to help you with some of those day-to-day tasks can be really useful. And obviously to seek professional support when it's needed. The next tip is to build family cohesion and strengthen all types of close relationships. So the very first tip to strengthen those close relationships is to practice giving people full attention. So I don't know about you, but I often find myself half listening to what my children are saying when I pick them in the car, I pick them up after school, and thinking about what else I have to do when I get home. I've got to get the washing off the line, I've got to get the dinner, I've got to fold clothes. And when I'm like that, I'm not truly present with that person, giving them full attention. And one way that we could all strengthen relationships is really listen and be there for those people who we care about. So instead of running your to-do list through your head or thinking about what you've missed for the day or thinking about what you've got to do the next day, actually just stopping, really seeing, listening and being with that person and hearing what they say and what they need from you can strengthen your connection. The next bit is called the 5-to-1 ratio or the magic ratio, and this comes from some research by a person called John Gottman, who's looked at relationships. And what he found is that the best predictor of a healthy, lasting relationship is that the ratio of positive, healthy interactions and comments to negative comments or interactions is 5-to-1. So for every one negative interaction, healthy people in healthy relationships have 5 positive interactions. And this sounds like, oh yeah, that sounds like that should be right and easy. But when I reflect, or if I'm not paying attention and I'm getting caught up in my stress, worry or busyness, what I find is that a lot of my interactions with the people around me are about what they need to do. You know, go get your shoes, pick up your clothes, put your washing out for me to wash, bring the bins in. And it's not positive. It's either just very functional and very transactional, or often it's quite impatient and spoken out of stress. And so the very one thing that you can do is really think about what is the ratio in my relationships that I care about, and what are some things I could do to improve that 5:1 ratio. The next thing that you can do to improve close relationships is to focus on people's strengths. And so I think we're in a world where we often focus on what's not right instead of what is right. And we often characterize ourselves and others by what we're not rather than what we are. And focusing on strengths has been shown in the research to increase quality of life, productivity, sense of confidence and self-confidence, and sense of efficacy. So thinking about what people are good at, paying attention to it, commenting on it, drawing their attention to it, these things can be very effective ways to strengthen relationships. And finally, again, I've mentioned peer support before. One of the predictors of really good adjustment to having a diagnosis of a serious chronic or rare condition is having good peer support. And one of the things I feel like is that patient support groups such as ITP perform a really important function. And I think one of my learnings as a rare disease parent and on my rare disease journey is, although I have a really good understanding of my daughter's condition from my own perspective, it's nothing like living with it. And her perspective and experience is very different to mine. And so the opportunity to share that experience with somebody else who's had a similar experience is very important, and really does shows in the research really good outcomes for mental health and well-being, but also with managing the condition effectively. So the other thing that you could do, the third thing that I really strongly recommend, is to nurture positive self-management of the rare disease. So the research, this theme comes up over and over again, that people who feel that they have some control, who have a strong role in the management of their condition, have more positive mental health outcomes. And there's a lot of reasons, I guess, hypothesized in the research about why this is, around feeling that you do have some control, having a sense of self-mastery, having a sense of self-confidence and self-determination are all factors that seem to contribute to this. So how do you do that? I think the first thing is about education. So learning about the condition, learning about the best ways to manage it, seeking advice and input from medical health professionals about the condition. These are all things that can help a person have that sense of what they need to do to best manage their condition. The second thing that I really recommend that you consider is, what are some of the barriers to building independence? And this might be different for different people. So for a person with a rare condition, it might be fear, concern, or anxiety about managing it on their own. It might be a feeling of having been disempowered by the health system and not feeling that you have power in the situation. For parents, and this is certainly my experience, my child was diagnosed as a baby, so for the first however many years of her life, I was really solely responsible for the management of her condition. So when it came time for her to start building that independence and taking some control, I did find it a little bit hard to let go and hand that independence over to her. So I guess in terms of nurturing that positive self-management, just try and identify if there are any barriers that are in the way and make a plan to overcome those barriers. And one of the plans that we found very useful is doing some really realistic goal setting and then providing support for achieving that goal. So starting with small things, where I think the very first thing at 5 that I started to hand over was her doing her blood testing and on her own, and filling out her blood test form by herself to send off to the hospital. And over time, I've increased her independence with that, to say, instead of her just doing the test, she's responsible for the timing of it, when it is, and making sure she's meeting her goals. Then we started looking at, could she take more role in managing her medications? And as part of that, I guess it was a team approach. So it's not a harsh, okay, you need to be independent, here it is, I'm giving it to you, I'm still part of the team, I work with her, we problem solve together when problems come up. And again, for her, accessing peer support where she can ask other people who've been through the journey questions. And in particular, I found connecting her with people who are slightly older than her. She's 14, so people who are in their 20s who've recently been through the same experiences as her, talking to them about managing the condition at school or managing it while you're trying to study and get effective exam results. Those have been really useful strategies for her. And the final, I guess, tool or strategy is to implement self-care. It's a pretty obvious one. I'm sure that you've heard it before. I'm sure it's not even surprising that it's included, but I think it's one that's easy to drop down the list when you've got so many other things to manage. When you're managing the rare disease day to day, many of us are also managing jobs and other aspects of family. So dropping self-care down the list is easy to do. So the things I'd like to say about self-care is to recognise first that effective self-care is very individualised and you need to find out what works for you. So things like physical activity, time in nature, adequate sleep, having an effective hobby, these are all things that can help, but it really has to be something that you feel resonates with you. So for example, I have friends in the rare disease community where that strenuous physical activity is one of their most important self-care and coping strategies. And I can see, I've got a friend who's a runner and I can tell when she hasn't been running because I can see her stress and anxiety increasing. I'm not so keen on the running, but time in nature, walking by the water with my dog, heading off to the beach, getting in the pool, these are all things that really help me to care for myself and feel relaxed. For some people, it's looking at sleep habits and sleep patterns and trying to find ways to improve sleep. And often this can be challenging for rare disease families, but looking at sleep as one of the foundations for mental wellbeing is useful. And then finally, interestingly, something that's very unique, I think, to the rare disease community is that participating in research can often give people a sense of purpose, of empowerment, and this strengthens well-being. So in terms of self-care, if you do have a routine, what I encourage you to do is not stop doing what works for you when you get busy. If you don't have some strategies that nourish you and make you feel relaxed or happy or improve your mood, I encourage you to experiment with a range of things that might work, and including looking back to the research to say things like yoga and meditation may also be useful self-care practices. So hopefully these 4 tips can help you to think about ways that you can best manage your stress and anxiety and the mental health challenges that come with living with a rare disease. So if you do want some additional resources, there is an excellent website, Head to Health. It's the Australian Government's mental health resource website, and they have lots of really, really good resources on there that you can seek out and use. And finally, if today, of course, we are living in a time of high stress, so in addition to obviously having a rare condition and all the usual stresses of life, we've now got a pandemic piled on top of it. So it is a difficult and stressful time. If you are experiencing distress or hearing this presentation caused you distress, I do encourage you to seek professional support or to reach out to one of the helplines, and there's some information about the helplines there. So I thank you very much for the opportunity to speak. I hope your conference goes well, and please reach out if you have any questions. Thank you.
Thanks, Louise. That was wonderful. Thank you so much. I know that I personally took a few little tips out of that presentation. It's always really important to improve and focus on your mental health, regardless of rare disease. I think, especially over the last couple of years, ensuring that our mental health is a focus and a priority, not just our physical health, is very important. And I think that I think we all took something from that presentation. Thank you so much. As Louise mentioned, if any issues were raised during that presentation, we strongly encourage you to reach out to Beyond Blue or Lifeline. We will put the contact information on our website and across our socials as well, but we strongly encourage you to reach out and to talk to somebody.